This week on Healthy Living, breaking the taboo on erectile dysfunction, a common yet complex problem facing men and their partners worldwide. How does erectile dysfunction affect men in Côte d'Ivoire, and where can these men find medical or psychological support? Plus, the impact of Russia's war in Ukraine on children's mental health. That's in this edition of Healthy Living. Hello, I'm Linor Moudou. Welcome to another episode of Healthy Living. It is a problem that affects millions worldwide, erectile dysfunction or ED, sometimes known as impotence. Erectile dysfunction is a difficulty to achieve or keep an erection. It can affect men of all ages, but is more common in older adults, according to experts at Johns Hopkins Medicine. They say physical health problems like heart disease, diabetes, and obesity, as well as psychological issues such as stress, anxiety, and depression can contribute to ED. Research published in the journal Nature estimates that over 300 million men worldwide suffer from erectile dysfunction. In some African countries, up to 30% of men experience ED, with the number rising among those over 40. Impotence is a growing concern among men in Ivory Coast, often leading to isolation. Amid stigmatization and a search for solutions, doctors and therapists are coming together to offer support. Yacine Sio reports from Abidjan, Côte d'Ivoire.
It has been 3 years since 23-year-old Junior lost what he calls his manhood. The cause? Erectile dysfunction, or ED, which disrupted his love life and plunged him into a deep sadness that persists to this day.
When I had sex with my partner, my penis couldn't even stay erect. I was engaged in intercourse, but I could feel that I wasn't really erect. She said hurtful things to me like, "You are not a man. You can't satisfy a woman." I didn't tell anyone about it. I only told my friend. Not even my brother or sister knew. It's just too shameful.
While studies specifically from Ivory Coast may be limited, general findings in African populations suggest that ED is often linked to chronic diseases, lifestyle, cultural, and societal factors. In many African countries, including Ivory Coast, social stigma surrounding sexual health issues can result in underreporting of ED, a subject of great concern for doctors. Dr. Fadli Koulibaly explains.
If the cause is anxiety, we offer therapies. If it's diabetes, we treat the diabetes. If it's related to sickle cell anemia, we address that. As a radiologist, I see patients who want to undergo a penile Doppler echo, but many don't even know this procedure exists. It's an important test to help identify the cause of erectile dysfunction. However, for this to happen, the patient needs to come to the hospital, where the doctor can assess their condition and determine the cause. This is the only way we can offer a proper treatment, unlike in other places where people are given quick fixes without understanding the possible long-term consequences.
In the heart of Abidjan, Riviera 2, a clinic offers a sanctuary for men who suffer from this condition. Dr. Aka Felix is a natural health practitioner known for his holistic approach to treating erectile dysfunction. He says he offers simple solutions to help men who are, quote, wounded in their pride.
Look at the average person's diet today. It's largely made up of cooked foods. But cooking strips away many essential nutrients. This is one reason why erectile dysfunction is becoming more common. Take celery, for example. If you drink a glass of celery stick juice every day to 4 or 5 days, you could experience up to 60% improvement in erectile function.
Some men turn to less conventional solutions, using natural treatments and home remedies, many of which promise miraculous results. Eunice Arithi is a trader who sells one of the country's most popular traditional medicines for ED, the Goro toothpick. According to medical journals, Torreya heterophylla is a shrub whose root has been used for centuries as a sexual stimulant due to its aphrodisiac properties. It's believed to restore a strong erection, even for those suffering from severe dysfunction.
The guro toothpick is a root that's straight from the ground in the village. It's completely natural. You just chew the toothpick every day and it starts working. Men can last 1 hour, 2 hours in bed without ejaculating.
However, these so-called traditional remedies are not without their risks. In fact, the Ivorian government recently banned several of them due to their toxicity. The public health measure aims to prevent further harm to those already suffering from this deeply personal issue. For Yassine Siao in Abidjan, Ivory Coast, Anthony Labruto, VOA News.
We asked viewers how informed they were about erectile dysfunction and what women could do to support their partners suffering from the condition. Here are some reactions from Kenya.
Yes, I've heard about erectile dysfunction. It mostly affects men. These are a condition where a man is not able to erect.
There should be enough public awareness about what exactly erectile dysfunction is, and that tell me that it's not witchcraft, you know. It's just an abnormality and it's just a normal human being, and there shouldn't be a stigma, you know, put onto men or pressure to deliver and everything.
In the society, most of the time, it's kept under wrap because people are ashamed of saying about it, and men mostly suffer in silence without saying about it.
I think it's for a man, failure to have sex is a big issue. So the woman should understand the man and avoid castigating the man for not being able to satisfy the woman in bed. So if the woman aggravates the situation by shouting at the man or by excessively demanding that sex when the man cannot, the situation gets out of hand. So the woman should be able to be on a point of understanding what the man is doing so that they go through this, they can seek help.
To support your man, you should maybe visit a doctor who will be able to assist in that.
Dr. Bello Abdulhakim is a urologist at National Hospital in Abuja, Nigeria. He explains the causes and impact of erectile dysfunction and shares some strategies on how men can address the condition.
Erectile dysfunction is the inability to get the penis erect for the purpose of sexual interaction with one's spouse. Even when you can get the penis erect, if it is not able to perform the function, specifically penetration, it is also considered as erectile dysfunction. As professionals, we class the causes into about 2. Most erectile dysfunction is as a result of psychological issues. So if you're having economic issues, if you're having issues with your job, or even issues with your spouse, it can affect your ability to have erection. And then the second one, which is not as common, is where there's actually something that causes the erectile dysfunction, either an accident or drugs that you are using for common illnesses like hypertension, diabetes. These are illnesses that you know people begin to have as they grow older. So the disease itself, hypertension, diabetes, can cause erectile dysfunction, and the treatment for the disease can also cause erectile dysfunction. Someone who has prostate cancer or some prostate issues and is having treatment for prostate issues, some of the drugs also cause side effects. After certain surgeries, if you have radical surgery for prostate cancer, it can affect your ability to have erection. So see, these are some of the common causes of the pathological erectile dysfunction. So most men don't want to be vulnerable enough to say, I have some problem with my masculinity. So you find people not willing to seek care when they begin to have problems, and this affects how quickly they are able to be diagnosed and treated and how they present themselves. And it also affects your ability to measure the true communal weight of the problem, to to be able to say, okay, this is actually the number of people suffering, because they are reluctant to come out to seek care. So a lot of them begin to use a lot of traditional medication or some other stuff without seeking healthcare, without trying to know exactly what is going on with them. They begin to also act out within the house to avoid interacting maybe with their spouses in such a manner, and go outside to experiment in order to test their masculinity. So these are the ways that they manifest. We have to raise the level of education of the general populace, as well as the health consciousness and the health-seeking attitude. The moment you improve all this, more people will feel confident enough to come out to talk about these problems. Some of the other things you can do is, and the more confident they are, the more they realize they are not alone in suffering from these conditions, and it opens up the both the level of the conversation as well as the options available for managing erectile dysfunction.
Now, among the lasting effects of Russia's war in Ukraine is its toll on mental health on the country's children. As Lysia Bakalets report from Kiev, their parents often also need help.
The room where Lev and Thea are playing trampoline on the sofa, hit by a Russian projectile at the beginning of the full-scale invasion in February 2022. Fortunately, the family managed to leave before the attack.
We went to the nearby village Moshchin. It was the first day of the war, and the local airport was nearby. We heard explosions both day and night. It was so loud.
The family managed to get to the relative safety of western Ukraine. Then Larissa and the children fled to Poland. She says each of the children reacted differently to the stress of the moment. The middle son, Lev, did not sleep well and developed anxiety.
It was not only the fear of loud noises. He became afraid of the sight of blood. With every scratch, he asked me if everything would be all right with him.
Anxiety is the most common complaint at the Voices of Children charitable foundation, which provides psychological support to children suffering from the war.
OCD symptoms may appear, doing some kind of rituals that seem to ensure that everything will be okay. The child may bite his lips or pick his nails, washing hands so often that the skin is damaged.
The foundation staff say it is often difficult for children to socialize, so they have special arts classes like this one, where children create stories.
Many are internally displaced children who recently moved to Kyiv and studied online before. At the first meeting, one girl from Kharkiv couldn't come to the class and mostly stayed in the corridor. It took her about 2 hours to join us.
44% of Ukraine's children show signs of post-traumatic stress disorder, according to a UNICEF-sponsored study.
More children with PTSD symptoms are from the regions where hostilities occurred or that were under occupation. Among symptoms are intrusive thoughts and avoidance behavior, where a child says, "I won't go to school. I remember that there were troops stationed there."
Larissa decided to visit a psychologist when she realized that her son Lev was becoming completely different from his former self. But she says it turned out she needed help as well.
I transferred all my worries to the children, and mostly it affected my middle son. A psychologist said Lev has so many fears and has stopped trusting even me.
Working with a specialist helped both Lev and Larissa. But Yana says the family realized they all needed to return home. Their city was unoccupied, their apartment restored.
There is no right solution, but we decided that the family must be together, so we came back because of our dad. The children needed him.
Larissa says she realizes a moment of crisis can return at any time, but she now has an action plan to help her children deal with stress, or what help to turn to if she cannot cope on her own. Lysia Bakalets, VO News, Kyiv.
Thanks for watching Healthy Living. For the latest news and coverage, stay connected to Voice of America at voaafrica.com. You can follow me on X at Linormudu. Until next time, stay well and strive to make every day a healthy day.